Mandibular arch, we have selected number 2 tray. The kneading of the material without incorporation of any water, making into a soft ball first. Fold it inwards so there will be no irregularities on the surface. When you are loading for mandibular arch, try to make a depression in the middle and try to make a rope. Spreading the material is very crucial when you are making a mandibular impression. Load more material on towards the lingual sulcus. Do not make any deep finger indentations at this stage. Increase the height of the lingual flanges. Lock in the material towards the outside of the tray. Temper it. Reflect the lips and rotate the tray in the patient's mouth. Check whether the tray is extending properly, centralized or not. Slightly apply gentle pressure on the molar premolar area. Let the material flow into the vestibule and check the extensions of the tray and perform initial border molding movements by pulling the lips and cheek outward, upward and inwards. Same on the other side. Relax. Ask the patient to relax his lips and cheeks and pull the lip out upwards. Ask the patient to take the tongue out. Take it back in, to the left, to the right, and let the material set. Of which the borders have to be refined and corrected. This is the snap mandibular impression. Now you can see the borders are very thick on all the sides, which we are going to trim and record them again. The borders are trimmed. Taking a good palm and thumb grip, trim the excess. This patient had moderate resorption of the mandibular and maxillary arches. So if the mandibular ridges are resorbed, try to take wider and broader trays. As the mandible resorbs, it resorbs in a outward direction. Trim the lingual borders as well. Cut this. Have been trimmed, they will be flamed and we'll be shaping it one side at a time. If there is any exposure of the tray, the impression has to be repeated. The tray is placed again and border molding performed on right side of the patient. You can see the borders now well rounded on the right of the patient. Performing the border molding movements on the left side, and anteriorly you can massage the edges. In this patient, the anterior part of the advanced resorption of the mandibular arch, you see a flat area in the anterior part which helps in getting more area for the patient and increase in support of the denture. Anteriorly first, temper it again, and ask the patient to just touch the upper lip, and take the tongue back in. You can see the semilunar crescent area and the lingual frenum recorded nicely now. Shape the mylohyoid and retromylohyoid areas, tempering it again. Take your tongue out, sir, to the left, to the right. Even if you are doing on one side, you have to ask the patient to move the tongue onto left and right to record the depth and width of the lingual flanges. After completion of the border molding or the completion of the borders, you have to read the impression from the peripheries, both buccal, labial, buccal. Come back, check whether the retromolar pads have been recorded or not, the S and reverse S shape of the lingual flanges, the semilunar crescent area, and the anterior ridges. Here we have a flat anterior ridge in the mandibular arch, so we are going to check and modify it in the special trace and record accordingly.